My name is Lauren Severe, and I got to do Spina Bifida. And this was really interesting for me because I have a really close friend whose son has Spina Bifida, and it's just very. I know many people who have children who have it, but they're all so different. Not one of them is the same, and so I was very I was very happy that I got this disability to learn more about. Here is a YouTube video for my introduction video that explains it very well. Let me click on it.
Spina bifida, or its most severe form, myelomeningocele, is the most common central nervous system or neurologic birth defect in the world.
Myelomeningocele is a defect in the spine. It's failure of the spinal cord to close.
The spinal cord, or the neural tube, as the embryologists say, forms very early in gestation, certainly before 8 weeks gestation. And spina bifida is thought to be a failure of the formation closure of that neural tube, so that the spinal cord elements are exposed to the intrauterine environment.
It's a progressive process. It's a progressive injury, so that by the end of pregnancy, there's been direct traumatic injury to the spinal cord, and there's been injury from the amniotic fluid itself.
Because of changes in pressure and fluid flow, babies are also at risk for developing hydrocephalus,
which is a fluid buildup on the brain and which damages the developing brain.
Virtually every child with myelomeningocele or spina bifida has an Arnold-Chiari malformation on X-ray. And what it is that the back part of the brain, called the cerebellum, that has a lot to do with control of motor movements, is wedged down into your neck.
The cerebral spinal fluid that cushions the brain and cushions the spinal cord leaks out through the back through the open spina bifida defect. That leads to the back part of the brain getting sumped down into the upper part of the spinal canal. That in turn can block the circulation of cerebral spinal fluid in the brain because the fluid is produced in the brain and then there's no way for it to circulate beyond that blockage point.
So if there's a blockage in the flow of that fluid, then the water builds up inside the ventricle. So you've probably heard the term water on the brain. The water isn't on the brain, it's inside the brain. If you don't treat that, then you end up with a massively enlarged head, you die, or you end up with severe mental retardation.
So in order to minimize that ongoing damage of pressure from the fluid, the pediatric neurosurgeon places a shunt tube.
It's a simple device. This is a shunt. It's made out of silicone. This end goes through a hole in the back of the head into that water cavity and tunnels down into the skin and goes into the abdomen, which is able to absorb the fluid. It's not a cure. It treats the symptom. It doesn't treat the disease.
Once you have a shunt, there are multiple complications that can arise from it.
The shunt can become infected, which is a serious complication because then the brain and the layers of the brain can become infected with meningitis and encephalitis. And with each bout of infection, that can affect the brain function.
And then, of course, there are mechanical problems. They clog, they break, they get to be too short, they migrate.
So it's not unusual for a child with spina bifida who has a shunt to require that shunt, and not only for life, but to have that shunt changed at least 5 or 6 times during the course of their life.
It's important for parents to understand the potential complications or ramifications of spina bifida after the diagnosis is made.
A child may experience difficulty with apnea, forgetting to breathe. They may also have breathing problems, choking, blue spells.
In the worst case, you end up with a child that's on a ventilator with a tracheostomy and a tube in the stomach to eat. And that is a huge impact on your quality of life.
Spina bifida can cause paralysis in the lower extremities that can interfere with the baby's ability to walk, or they may even be wheelchair dependent.
They also have difficulty with their bowel and bladder function.
Most of these kids, when they become older, have to catheterize, or else they have to wear diapers.
They can develop significant curvatures of the spine because of instability bony instabilities of the spine if they have a high lesion.
Because of the lack of innervation to the feet and the ankles, there can be the formation of club feet, or the medical term is talipes, as a consequence. So that requires orthopedic intervention after birth.
And then there are problems that can come on later on in life. It's not even necessarily done when you're a baby. You can get tethered cord, which means that the nerve tissue gets caught up in scar tissue and you can lose function. So it's a lifelong issue of disability.
Okay, so that was a very interesting video to me. My friend who that I was talking about that has a baby with spina bifida, she was told that her baby was not going to make it after birth, and he has made it. He's doing great. He's had to have the shots like they explained in the video, and he's had to have them actually replaced, I think, twice because they get infected. My friend has to go through a lot, but she's just very blessed that she has her baby. So, characteristics and or early signs of spina bifida. Spina bifida is usually caught during pregnancy, as you can see in this ultrasound. This is a patient at 20 weeks with spina bifida. More mild cases are caught right after birth. Also, an interesting fact, a mother who has had one baby with spina bifida has a 3% chance of giving birth to another child with spina bifida. And this is so true. Another one of my friends that I know, she has 2 boys, and they both have spina bifida. They are 3 years apart, and unfortunately, they just both have spina bifida, but they're alive, and she's grateful for that. Causes of spina bifida. So the causes is that they're birth defect from the spine and the spinal cord not forming properly. A piece of the neural tube does not close properly, which causes the defect in the spinal cord as well as the bones of the spine. It can also be caused from a folic acid deficiency. That's why gynecologists push that you really take prenatal vitamins with folic acid while you're pregnant, because getting that folic acid is so important. And also drug use during pregnancy, which drug use and alcohol use during pregnancy can cause multiple things, but spina bifida is one of them. How spina bifida impacts students? Well, as from that video, you saw many ways. Some students with spina bifida are in a wheelchair because they are paralyzed from the waist down. They cannot urinate on their own, so they have to have a catheter or a diaper. Life-threatening latex allergy, mental, social, and sexual problems. And students who have the most severe form, which is I cannot pronounce it, myelomyoglossal, can have leg deformities, hip dislocations, or scoliosis. This is caused from having a tethered spinal cord and it being attached to the surrounding tissue, making it where it cannot move freely like it should. Treatments for spina bifida. There are different types of spina bifida, so there are different types of treatment for each. Spina bifida occulta, there's no treatment. Meningocele, and excuse me guys, I cannot pronounce these, just bear with me. It's treated with surgery and most likely will not be paralyzed. And the most severe form, which requires lifelong treatment, is the the child usually, if they survive birth, they have surgery within hours after being born to close up the opening in the spinal cord, which is then covered up with muscles and skin. So they take skin grafts from other parts of the back and sometimes off the body to cover that up to prevent infection. So here's a picture of the types of spina bifida. So here's the first one right here is the I can't even think what I'm trying to say. It's the least severe. Then here is the next severe, which can be treated with surgery, just removing that. And then here's the most severe. So you have all of the spinal cords in there and all that fluid around, which leads to having shunts in the brain. So there's all kinds of difficulties that come with this, and it's so sad. It breaks my heart. This is a picture of club feet. This is what they explained in the video. So usually this can be fixed with surgeries and having to wear little boots to straighten the feet out. And here are some pictures that I found that just shows how different, how spina bifida doesn't affect children all the same. This one right here, I love this little picture of this little girl. Look how pretty she is. She has to have a shoe that has a thicker sole because her hips are one leg shorter than the other. And this little baby right here, he just has that little bitty scar from where they removed the lump and a cyst in his back. And then this little girl right here, she's walking. And then these are the children who are going to be in wheelchairs. But they're just all precious children. And it breaks my heart that they have spina bifida. But it also makes me happy to see them smiling. They're all happy. And here are my references.